Good morning, good afternoon, good evening. I'm so excited that we have been able to not only get together for presentations of new members, but that we can get together and do some think tank work, which we haven't been able to do for a year. And I'm so excited that we have 43 participants, which I think is a very good attendance. So thank you all for participating. I'm going to speak a little bit about the Healthcare Think Tank Committee, and Bland Godfrey is here, and he's been working with me and working separately in that area, doing some very important work with the World Health Organization, and have him share some of that. And mostly I'm going to talk about some work I have been doing with trees leaders around the world. And I'm curious how many people who are on the call have knowledge about trees. So you'll notice at the bottom of the screen, there's a button called chat. And if you could, as I'm speaking, take a couple minutes and indicate on a scale of 0 to 5 what your knowledge of trees is, with 5 being an expert instructor and 0 having no clue what I'm talking about. That would be helpful, and I'll continue speaking. Trees is by many considered to be the #1 innovation system in the world. It came out of Russia. Work began to be done on it in 1946 by a man named Altshuler in the Russian army. And his job was to collect patents and to organize those for the Russian army. And he became fascinated by the fact that some patents were significant change in science, and many patents were just a small change. And so he focused on the ones that were significant change and began to ask what was the thinking that went into that patent. And then he organized that into an expert system and developed an innovation system that enabled him to work with his colleagues on problems that had a contradiction. And by a contradiction, what he meant was one thing would be improved in the design and another thing would degrade. And what he wanted to do was create a system that eliminated contradictions, and so that there would be as much as possible a just improvement. So one of the examples where that's been used is in the Boeing company. They had customers who wanted jets that would take customers further, and also jets that would seat more people. So to do that, there needed to be an improvement in the materials of the plane, and there needed to be improvements in the engine of the plane. And he used the tree system to work on that, and he developed a plane, a jet known as the Dreamliner, which was very successful. And it goes further than a lot of jets were going, and it holds more people. And the benefit of his invention was $1 billion. And that some of that was from the extra sales, and some of that was from savings in construction and in the materials that were used in the plane. So that was a pretty big success. The trees is applied today to most industries. I was talking to some of my colleagues, and they have worked in all of the auto companies. They were talking about the current involvement in Toyota, which is an important background of our new president. And Toyota in Japan is very active with the top trees people in Japan. Maybe just one other anecdote. When I was at a meeting at American Society for Quality in the U.S., there was a delegation there from South Korea, and the delegation said they wanted to know what was the top innovation system in the world, and I told them it was trees, and they said, "Can you get us someone who can help us?" And I knew Nikolai Kamenko was one of the top people in terms of trees, and he went to work for Samsung. And in the first 4 months that he was at Samsung, they saved $1 billion. So this is a very sophisticated engineering tool that saves a lot of money. 2 months ago, I was contacted by the two top people in the U.S. who do trees, and Boris Slotin and his wife, Alla Zussman, and they were considered by Altshuler to be the top two trees people in the world. And they asked me if, knowing my interest in trees and my background in quality with the IAQ, if I would develop a new system that would take the thought patterns of the trees and apply it to social problems. And I said I would be willing to do that, and I started on that in about 3 months ago. And I had at my disposal some of the top trees experts. It's been an interest of mine, but certainly not a focus. And so we went to work on a couple of projects. And so in my notes here, I have mentioned some of those. If we can go down just a little bit, please, Liz. So that's fine. So the first one that we began to work on is the COVID-19 pandemic. And we put together a small team on that with a member from Ireland who was a sociology professor who taught sociology at the nursing school to 240 nursing students and was very knowledgeable about healthcare and very interested in the pandemic. And we began to put together the trees system, applying it to the pandemic, and we had some, we think, were significant improvements. So if you go down just a little more, Liz. Okay, so right there's good. So there's 4 parts to the trees system, and what we've been asked to do for the social entrepreneurship, social innovation system is to make it usable to people who do not have an engineering background, who do not know the very sophisticated, expansive tree system. And so we meet in small groups called cafes, typically about 7 meetings of about 45 minutes to an hour and a half for each of the meetings, typically once a week, sometimes twice a week if people want to finish more quickly. And we use the power of trees, but we use it in a way in which a lot of the grunt work is done by the expert in between meetings. And participants with little or no background in trees are able to use it to come up with important breakthrough ideas. So the first phase of it is to map out some of the key things about the problem. What's the super system, the system, and the subsystem? What's happened in the past, present, and future? What's the key problem that we're trying to solve? And a very important part of that is what is the positive functions and the negative functions. The second part is to draw a diagram. And if you can go down a little more, Liz, you'll see a large diagram. Next page, there you go, that's fine. So this is the diagram for the pandemic. And you can see that there are different squares, different colors, and lines connecting them. The lines indicate what items are affecting others. And some of it is related to healthcare, and some of it is related to human behavior. The human behavior issues, as I'm sure you know, is what social distance people are keeping, being at least 2 meters apart, the wearing of face masks, the washing of hands, and so on. The medical issues relate to what we've learned about the medical aspects of the pandemic. What happens next then, you can go down just to the next page, Liz. Okay, right there is fine. And so what the third piece is there a piece of software called the Formulator. And what the Formulator does is it identifies conflicts from the diagram and then makes suggestions about what the problem is that needs to be solved. So, for example, on number 14 there, I'm not sure you can read it, I'll just summarize it quickly. The Formulator came up with find an alternative way to obtain healthcare workers use personal knowledge that offers the following: provides or enhances fewer people get infected, does not cause conflicting messages that are confusing, and is not influenced by information about new treatment saves lives. So there are some positive aspects to that and some negative aspects. And so the question that's raised to the CAFE members is how to come up with solutions to that. And so in this particular one, the kinds of ideas one was called CBOC, the body of knowledge of the pandemic, the COVID body of knowledge, excuse me, that's what I was looking for. And in that is captured the different things, and the focus is to make best practice common practice. And we find that this is not happening. A second aspect that emerged from this analysis is that there's a lot of problems that youth are not following the guidelines. They're having the parties, and in big cities, this has become a major problem and is a major component to the increasing in most countries of the pandemic right now. And so we looked at some of the issues of could we get stars who are popular among the youth to encourage youth and educate youth about the problems that's caused by not following the guidelines for the pandemic. Okay, so why don't I pause at this moment? Bland Godfrey has been able to spend some time with us. He has been working with, has had an interest in trees, but also has been working with a local college in North Carolina, North Carolina University at Chapel Hill, who's working with the World Health Organization. And Bland, could you share perhaps some things about your impression of trees and its benefit for healthcare, and some things about your work with the World Health Organization, which has a priority of reducing infant deaths? Bland,
Yeah,
go
yes.
ahead, please. Thank you.
I'll just add a little bit. First of all, I've been very impressed with the trees approach. I teach part of trees in the Lean Six Sigma graduate courses that I teach, but basically an introduction and a limited number of the solution set. But I've been reading about it and studying it for a long time. But still at level 2 or 3. But so I was able to sit in on a couple of the cafes that Bob organized, and they've been sending me the recordings and the written reports of the others that I've been following. My main work here is the World Health Organization Coordinating Center is at the Gilling School of Global Public Health at the University of North Carolina. And I've been working with them for the last 6 years. We're now up to about 10 fully funded graduate students, about 4 funded research professors, and about 3 other faculty members that are working together across statistics, industrial systems engineering, computer science, health informatics, and of course, public health. The Sustainable Development Goal 3 in the United Nations, as many of you know, is focused on global health, and one of the goals is to reduce maternal and child mortality, that's 0 to 5-year-old kids, by 50% by 2030. Many of the 193 countries are not meeting the goals. Many have done very well, but the real interest is in identifying the best practices across the world and helping implement these practices. My particular work is on the data, what we call dynamic interactive data visualization and utilization, creating an easy way for people to see what's happening and how to learn from many countries with great successes. UNICEF has gotten very interested. They have a new senior person who's head of data science, and some very talented people working on dashboards, data visualizations, looking at different tools. So this summer, I had another 18 graduate students working with us, looking at these tools, evaluating the dashboards on all sorts of different healthcare organizations that we could find throughout the world, and then going through healthcare journals and looking at what people are doing, what's working and what's not working. We had 2 other teams working and people from supply chain management, and we published, well, it will be published about quarterly next month, recommendations to the Strategic National Stockpile in the United States, and also some other work with another group on data quality, on how to monitor, use data for pandemics. So that has kept us quite busy. And the interesting things that we're finding out from these dashboards, data visualization, interactive plots, dynamic plots, is the healthcare organizations are fairly much behind most top industries, not all industries, because there are many companies that are kind of brain dead in this area too. But many companies have used data visualization remarkably. I think it was one of the things that stunned us in 1983 during benchmarking trips to Japan, with how well Toyota, Nissan, Honda, and others used visualization throughout the plants and throughout the business offices. And American companies, I think, have been trying to catch up, but some of the recent work, especially with some of the software that now exists, has been very, very good. And you know, you can think of NASA's command and control center. You can think of AT&T's network control center. You can think of many of these very fancy dashboards or interactive plots as what's possible, and that's possible in healthcare too. So that's Where we've been working, and we've been working with many different universities and many different healthcare organizations throughout the world, and learning what they're doing, and then how do we share this. So basically, these dashboards are a way to share these best practices very quickly.
Thank you. So it's been a pleasure. We're trying to figure out how to clone Bland because he seems to have about 3 or 4 different jobs, but it's been enjoyable to interact with him on this. I'm going to ask one more question. I'm going to give one more brief example, and then we'll throw it up to questions. How are we doing time-wise, Liz?
Bob, you're good. By my clock, we have about another 15 minutes.
Okay. If we can keep it shorter than that, we'll do that. So I'd ask, thank you for sharing in the chat, many of you, your knowledge of trees. There's quite a range. Most of it was in the range of 2 to a 4. And thank you for sharing that. I'm going to ask one other question. I'll ask you to respond to in the chat, and that is, what is your interest in learning more about advanced trees and applying it to social issues? Again, if it's high, put a 5. If it's a low, put a 0 or a 1. And we can follow up with that afterwards. The second example I want to mention is just that this can be applied in a lot of different areas in terms of social innovation. And we have a project going on in Kenya, and the student of trees, who's been a student of mine in innovation for 5 years now, and has taught 200 innovation leaders as part of YALI in Africa, the Young African Leadership Institute, did a project related to the pandemic and the closing of schools. And the problem that he found was that among the poor third of the middle class, people did not have Wi-Fi access in their homes, or had a very limited Wi-Fi that only lasted 15 minutes. So he came up with a system using trees, cafes, to use a memory stick and a television and to be able to record classwork for students in grade school who were totally shut off from the education system when the Kenya government shut down all the schools because of the pandemic. And the number of students who will benefit from this is about 2 million students. And South Sudan approached him 2 weeks ago. They want to do something similar there. And he has an interest of using trees for all of the 17 UN Sustainable Development Goals over the next coming years, and he wants to make Africa the innovation continent. So very exciting kinds of work, and I'm hoping that some of the members of the Academy will find interest in this. We are committed to the 17 Sustainable Development Goals as a member of the UN Compact, and I'd like to see us make some serious progress this year. I know people are crazy busy. The pandemic has not made life easier, it's made life harder, even though we can have meetings like this on Zoom. So thank you for your interest in this. Why don't I throw it open for questions at this point, either for Bland or for myself.
Okay, it looks.
就非常感谢啊，非常感谢刚才那个谁呀，Bob 先生的一个介绍，你翻译一下。
Thank you very much for the introduction from Mr. Bob King.
你的介绍引起我极大的兴趣。
I'm so interested in the topic you are talking about.
但是介绍以后，我到现在也不知道这 Trace 系统是一个什么样的系统，能不能将来在网上公布一下详细的架构和它的用途机制？
But but in the same time, I'm a little bit confused about what the trees system exactly is. Could you please give some follow-up introduction on the trees system? Maybe now, maybe in the near future on the internet for us to learn.
当我们理解这个 Tracy 系统整个架构的时候，也许它能够，我们能找到更多的切入点，比如说更多，说 Tracy 系统在更广泛领域得到应用。
When us totally understand the tree system, only based on this understanding, maybe we can give you some suggestion, or maybe to have some follow-up suggestion or comment on this topic.
Yes.
So
Thank you.
Bob,
Yes, so thank you for your question. Yes, please, Liz.
Bob, what I might suggest is if there's a good link or something that you could send people to, maybe send that to Glenn to include in the minutes.
对。
and they
Yes, so
can get people started.
yes, so thank you for your question, and so I'll explore with Liz a couple of different possibilities on how we can respond. We can certainly give you a reference to some materials. We could have even a couple of Zoom meetings if you wanted to do that, in which you'd have time to ask more questions, and we'd have time to go into this in more detail. Maybe just one more quick example that I've mentioned in past meetings of the IAQ, and I'll be brief and save Liz some time. I spent almost 2 decades working on the problem of diabetes, and diabetes is the major driver of cost in healthcare in the U.S. And we found that the number one cause of that was mistakes in prescriptions. 50% of the prescriptions that were written were wrong. Too high a dosage, too low a dosage, wrong med, wrong combination of meds, and so on. And when we analyzed it, we found that there were a lot of people who were opposed to us fixing the problem. The hospitals made their most amount of money from diabetics, so they didn't want to eliminate too much diabetes because they have empty beds. The pharmacy companies, the solution would be to get pharmacists involved. The pharmacy companies didn't want to get pharmacists involved because then they would sell less pharmacy. The people who, the companies that were healthcare companies, if we reduce the amount of diabetes, then there would be less money spent, and they get only a percentage of that. So there are in the world, and especially in the UN Sustainable Development Goals, the reason that these are the toughest problems are there are conflicting interests. And what trees enables you to do is to find solutions in which you get win-win-win, and you solve these conflicting problems. So I think if we spent some time separately on a Zoom meeting or correspondence, you probably have some of these very thorny, difficult problems that you're working with that can't be solved because there's conflicting interest. Contradictions is the term that trees people use, and it has the best proven techniques to solve these kinds of thorny problems. Is that helpful?
Excuse me, may I share one PowerPoint to reply to Mr. Jiang?
Yes.
Yes, and then also.
So my question is how to use the engineer parameter to solve the social problem, because it is a more likely as the engineering. So we used to solve the laboratory problem For example, our reliability laboratory tried to use to solve some contradiction during the testing. However, it is interesting you use in the social event and solve the social contradiction. And another question I meet the problem is how to transfer the general solution to become our specific solution. I think it is the gap and very difficult, even though after the contradiction, we find the inventive principle, and then we need to use this general solution become our specific solution. The most difficult, I think, is in here. That is my comment during my experience in the trades. Thank you.
Thank you, Lotto. Okay,
So I think it is a very new idea to use to solve social contradiction problem, especially in the comment lighting. But in the technically, I'm interested in how you overcome this technically barrier.
yes.
For this last issue, I would say there are some matrices where all the characteristics, the contradictions, are being translated into human resources language, IT language, marketing language, commercial language. So when you find these very manufacturing characteristics, these translations allow you to understand how to see them from another perspective. So you can see what asymmetry can be understand from the human resources function. I think that those things, those matrices can help a lot for the first of these two issues he was mentioned.
Okay, very
Very
good.
good. Thank you.
Thank you.
So thank you very much, and I'll be happy to contact individual members of the Academy one-on-one, and anywhere from simple questions to how to develop some skills in this area. So thank you for your interest.